My name is Dr. Shankar Acharya and I am today going to talk to you about lumbar disc prolapse or lumbar pain or back pain. This is a common problem that you and me or everyone in this world right from childhood to adulthood would suffer at least once or twice. So it's very important to know about spine and how to look after it. Every human being, since we walk on our 2 feet or 2 legs, will suffer from back pain any given time due to bad posture, lumbar disc disease, degeneration of the spine, a disc prolapse, and various other elements affecting the spine. The spine is unique in our body because it has been made so dynamically that while it contains the spinal cord which is connected to the brain, and the spinal cord gives out nerves to all aspects of the body. And can you imagine that the nerves have a dual function of receiving sensation and then initiating action by muscular activity and also giving you the sense of position. So, and the spinal column is flexible as well as rigid in that it is in a bony cage which is called number of vertebrae from cervical, thoracic, lumbar and sacral, and these vertebral bodies are aligned in a special form to give you the best ergonomics of function, movement with flexion, extension, torsion and flexibility. Inside the spinal cord is a bony canal which is called the spinal canal, and in the spinal canal is the spinal cord which starts from the brain at C1 and ends at just above the lumbar spine, which is L1. And the spinal cord is so sensitive to touch, it is surrounded by spinal cord fluid which is called CSF. As we age, the discs in between the vertebral bodies degenerate. So as you see here, this is the spinal cord. So you can see the spinal cord, this is the vertebral body, this is the disc which I was just talking about. And this disc is in between 2 vertebral bodies and it forms called a functional unit. So it allows you to bend, it allows you to rotate and twist, but still save the spinal cord from touching any bone or any of its structure. As we grow older, the disc degenerates and then touches the spinal cord or the nerve roots, causing back pain or leg pain. The spine is such a complex organ that it has got bone, it has got disc, it has got ligaments, it's got muscles, it's got joints, and all this holds the spine together. It is like your long tower with ropes, and it also has a cushioning effect. So it is very important to keep your posture of your spine. So in the today's young generation or the millennial generation, where they are always hooked onto computer phones, they don't look after their posture or they slouch in front of a TV, thus causing back strain. So if you get back pain or back strain, the first thing to do is first take home remedies which are normal, crocin pain relief or crocin medicine, things like that, and take some balms and take some hot packs and do some physiotherapy. However, if the pain persists, you should see an orthopedic spine surgeon who will then check you up and look for any problems, because if you have long-standing back pain, then you should definitely go and see a doctor and get investigated and check neurologically, because if you have persistent back pain, you may be suffering from diseases like infection, disc prolapse, tuberculosis or any other possible sinister diseases. So just to summarize, back pain is very common. Everyone will suffer it. You should look after your back. When you get back pain or strain or neck pain or strain, you should initially take home remedies. If they persist for more than 3 weeks or they persist at night and cause back or leg or hand or arm pain, then you should go and visit your doctors. They will check you up and then investigate you accordingly.